First, remember the general observations that apply to any system. Apply these specifically to the gastrointestinal exam. Is the patient well or unwell? Are they awake and alert, drowsy or asleep? Is the patient breathing comfortably or are they dyspneic? An incentive spirometer is often given to post-operative surgical patients to encourage deep breathing where such breathing can be painful. Comment on whether the patient is overweight, cachectic, fluid overloaded or dehydrated. The gastrointestinal patient may be yellow from jaundice, pale from anemia, have blue peripheries from cyanosis, or hyperpigmentation from uremia. Note also any areas of discoloration, such as purple striae, the bluish periumbilical hue of Cullen's sign, the sinister ecchymotic flank discoloration in Gray-Turner's sign, or their hyperpigmented velvety appearance of acanthosis nigricans. If the patient is yellow or brown, look for scratch marks. Enteral feeding options include a nasogastric tube, percutaneous endoscopic gastrostomy, and jejunostomy tubes. If present, note the enteral feeding bags that drain into these devices and their contents. Total parenteral nutrition is used for patients at risk of malnutrition who do not have a working GI tract. These patients will also have some form of venous access, such as a PIC or some kind of central line. Note the presence of a bag or bowl for vomit. Post-operative patients may have some of the following. Note any drains. Note their location, their contents, and corresponding scars, which provide clues as to their purpose. Note also if they are open or closed, active, which means under suction, or passive, meaning without. A wound or scar. Know which abdominal scar corresponds to which types of surgery. Patients are sometimes unable to tell you which surgery they have undergone. If you see a stoma, comment on its position, its contents if visible, and any signs of any of the complications of stomas, which you should be able to list if asked. Note if the abdomen is distended. Note if there are any prominent veins, particularly around the umbilicus. Look for equipment or devices that are attached to or surrounding the patient. Comment on any gastrointestinal specific medications, such as laxatives. Is the patient on oxygen? If so, how is it being delivered and at what flow rate? Does the patient have a urinary catheter? Note if the patient has an IV line, and if receiving any medication or feed intravenously, check the bag and comment on what they are receiving. Note any mobility aids around the patient. Note the location of the patient. For example, a patient may be on a general ward, or a gastrointestinal specific ward, or a surgical ward. Note any signs around the bed.